So today I'm going to be discussing two different types of contrast agents, both gadolinium-based. The funding for this study was provided by Gerbet. And just to start off with some background, both contrast-enhanced MRA and CTAs are valid techniques for imaging patients with thoracic aortic diseases. Although these patients tend to have to come in for annual imaging, it is better to use an MRA because it doesn't release any radiation. Two of the macrocyclic contrast agents that are commonly used that we'll be discussing are Gadoterate Meglumine and Gadobutrol. So Gadoterate Meglumine has been available in the United States since 2013, although it is more widely known and used in Europe. Gadobutrol has a higher concentration with a lower volume, while Gadoterate Meglumine has a lower concentration with a higher volume. And as you can see by the structures below, they look very similar. They're both macrocyclic structures, meaning that the ligands bind to the gadolinium ion to form a cube-like structure, and they both have the same amount of gadolinium in them. You might also notice that the relaxivity is slightly higher in Gadobutrol. And so if you were to give a 70 kilogram patient contrast, you would give them 14 milliliters of Gadobutrol with 14 milliliters of saline solution to get a total of 28 milliliters. And then for Gadoterate Meglumine, you would give only the 28 milliliters, no extra saline solution. And both of these are a double dose. So the purpose of this study was to assess whether Gadoterate Meglumine enhanced and Gadobutrol enhanced MRA provided similar image quality and aortic measurements. This study was IRB approved, and informed consent was obtained from all participants. We asked patients who had a clinical scan using Gadobutrol to come back to within 8 weeks of that scan to have a research scan using Gadoterate Meglumine. And the average time in between the two scans was about 5 weeks total. They had to have a GFR of 60 or above because they were getting a double dose of the contrast, and we used all 1.5T scanners. The injection rate was 2 milliliters per second, and we gave, again, a double dose of the contrast for both contrast agents. The Gadobutrol was diluted with a 1-to-1 ratio of saline solution, while the Gadoterate Meglumine was not diluted. So we had 27 participants. The average age was about 49. We had 24 males and 3 females. And the reason for their clinical scan was due to dissection, bicuspid valve, and aneurysm. Quantitatively, we looked at the two scans, and we looked at the aortic sinus at 3 different locations, going from sinus to sinus, and then averaged them. And then we looked at the sinotubular junction, ascending aorta, proximal arch, distal arch, and descending aorta, and used 2 different measurements and averaged those. They were looked at as you didn't know which contrast agent was being given, and so after we obtained the average diameters, we used a 2-way mixed effects model ICC to assess for the agreement between the 2 scans. Qualitatively, we had a radiologist blinded to the type of contrast used and in a random order look at 4 different locations on the thoracic aorta, the aortic arch, the ascending aorta, the aortic root, and the descending aorta. They used a 5-point Likert scale for image quality and a 4-point Likert scale for artifact, wall conspicuity, signal to noise, and contrast to noise. And then we used a Wilcoxon rank sum test to assess for rating agreement between the 2 scans. So here's our quantitative results. As you can see, the average diameters for both Gadoterate Meglumine and Gadobutrol are very similar. We also obtained an ICC of over 0.9 at all locations on the aorta. Qualitatively, for image quality, the average scores, as you might notice, are very similar, meaning that the images were comparable between the two contrast agents. And so here are the results for artifact, wall conspicuity, signal to noise, and contrast to noise. Again, the average scores were very similar, showing that these two contrast agents can be used interchangeably. So here is an example of one patient with their scans both side by side with the Gadobutrol and the Gadoterate Meglumine. And you can see that they are pretty comparable. One might be a little bit brighter, but when you're looking at them and not knowing which kind, it shows that they can be used interchangeably. And so here's another example. You might notice that Gadobutrol is slightly brighter, but again, our results did show that they can be used interchangeably. And then this last one for Gadobutrol has an artifact due to patient movement during the scan. So Gadoterate Meglumine actually looks a little bit better in this image. In conclusion, we quantitatively and qualitatively, we saw that Gadoterate Meglumine and Gadobutrol can be used interchangeably. They have comparable image quality and aortic measurements. And so some limitations are that the research scan and the clinical scan were not on the exact same scanner, although they were all on a 1.5T scanner. And the clinical protocol was more complex, which might have introduced some patient-related factors. Thank you.